Good afternoon, everyone, and welcome for today's Med Talks by IJCP. I am Ada, your host for today's enlightening session. This afternoon, we explore a topic that lies at the very heart of adolescent health: emotional literacy in teens, a new frontier and adolescence medicines. To guide us through this important conversation, we are honored to have with us Dr. Sujit Tamboli, sir, a highly respected developmental and behavioral pediatrician, researcher, author, and leader in the field of child and adolescent development. Dr. Tamboli, so a very warm welcome for today's Med Talk by IJCP. It's a privilege to have you with us today. Before we begin our discussion, let's understand what emotional literacy really mean and why it is becoming such crucial area in adolescent medicine. Emotional literacy refers to the ability to recognize, understand, and express our emotion. With all of this, I am handling the session with Dr. Sir. You can continue. Thank you.
Thank you very much. At the outset, I must thank IJCP for giving this opportunity because nowadays this is very important topic, and I will start my lecture immediately. Actually, emotional literacy in teens, a new frontier in adolescent medicine. We can see start with one case history. Rishika, a 15-year-old student of 11th standard, preparing for a competitive exam like NEET or medical entrance, brought by parents with mood swings, irritability, lack of motivation in studies since last 3 to 4 months, and the child has an elder sibling who has got admission into a reputed engineering college, and she was studying in second year, and the child feels compared with him by parents and teacher. So she has gained weight of around over this last 3 to 4 months and refuses to engage in family outing and avoids playing with the friends. So parents distressed about the child's lack of interest in studies for such a competitive exam and is finding it difficult to communicate with her. So for this we should start with the what is emotion, because we should know what is emotion. The term emotion comes from a Latin word e motere, meaning to move, and organized response which influences our action or interaction are emotions. So emotions exist in our brain and body in the form of neuropeptides, and emotions help us gather, organize, prioritize, recall, and process information, which is essential to both health and happiness. Emotions are like a wake up call, so which gives us information when our needs are unmet. So, what are your views on emotions? So, emotions get in the way. So, many people think that you should not be emotional, you should be prompt, and everything should be without emotions. So, that is not possible. But emotions make you less effective. That is also old paradigm. Emotions have to be suppressed or rejected? No. Emotions make you weak? No. Emotions interfere with your decision making capacity? Not at all. So, what is the latest research about emotion? Emotions carry data and information. Emotions and thinking are tied. Emotions drives behavior and decision making. Emotions are contagious. Emotions and learning cannot be separated. Emotions are real in the form of neuropeptides, and emotions are biodegradable. So that is very important. So what are the basic emotions wisdom behind feelings? Every emotion has a message. It's tough to decode the information, especially because we often have multiple paradoxical and layered feelings at once. So, one key is to identify the basic categories of feelings at any given time. So, every emotion has value and helps people survive and thrive in the pack. And here are some tips for the understanding of basic emotion. So, feeling, what is difference between feeling and emotion? Feeling is a simple and primary effective process, while emotion is a complex affective process. And feeling precedes emotional experience, and every emotional experience is accompanied by feeling. So, for example, feeling of pleasure and pain are connected with the emotional experience of joy and sorrow. So, thus, two affects emotion and feelings are closely and intimately interrelated to each other. So, emotional experiences are necessarily accompanied by feelings, whereas in feelings, emotional experience is not necessary. So, feelings of pleasure and displeasure may occur without any emotional experience. However, when feeling is expressed either in the explicit or implicit behavioral form, it takes turn into emotion. So therefore, it can be said that feeling is relatively less active process of affect, while emotion is an active affective process. So, feeling is always subjective or personal, while emotion may be both subjective as well as objective. So, for example, if it is possible to observe feeling of pleasure and displeasure, while emotions are objectively observable phenomena as they are expletively expressive. So, feeling are classified only as pleasure and pain, while emotions are of several kinds like anger, fear, joy, love, jealousy, excitement. So, what are the basic emotion wisdom behind the feeling? So, either emotions can be positive or negative. Uh, Positive like love, joy, or negative like anger, sadness, fear, anxiety. So we will see one by one. So anger, I'm angry. So what is the cause? My way is blocked because actually I was traveling to I was traveling to my office, and during that time there was a roadblock was there, and I was very angry with that because I'm going to reach my place at least half an hour late, and then my boss will going to fire me. So what is in the way? So what is in the way is, we know that what is in the way because of the traffic jam. And when the focus becomes clear, anger turns into passion. So that next day, either I will start half an hour before, or I will take another road. So what is the value? That anger helps clarify priorities and builds energy for the change. So this is from the equip kit, which is my friend Dr. Sandeep Kelkar has actually he is working a lot in the equip kit at Thane. And anticipation, I perceive something coming. So what important thing is coming? Anticipation is usually tied to something like fear or joy. So anticipation helps you to prepare for the future. So joy helps motivate you to do something again, and it gives energy. Fear helps you clarify that you care about and what needs protecting. So that is again important. So surprise may turn your attention to something new. Sadness helps you to clarify what is most important and reinforce what you should create in the future. Disgust helps you to know your boundaries and principles. Then what are the emotional vaccine? This also is very important nowadays. With the physical vaccine, it is recommended by Indian Academy of Pediatrics and prepared by Dr. Sandeep Kelkar that birth to 6 months, non-verbal emotional communication, that is emotional literacy, then development of trust and secure attachment, emerging socialization, self-soothing, then 6 months to 1 year, non-verbal communication or decoding other facial expression. Like that, it is up to 6 years and sorry 18 years. So what is difference between EQ and IQ? So EQ and IQ, EQ refers to the ability to recognize, understand, manage and utilize emotions effectively, both oneself and in the others. And what is the importance of EQ? It enhances interpersonal communication, builds self-awareness, improves coping under pressure, essential for leadership and teamwork. While IQ refers to ability to reason, solve problems, and understand complex ideas, and reflects logical and analytical intelligence. It measures analytical reasoning, logical thinking, and memory. So it is important for academic problem solving and strategic planning in sports or other activities. So what is the difference? IQ deals with cognitive sphere of the child, while uh, EQ deals with the emotional sphere of the child. IQ is static. After 4 years, IQ doesn't change more than 15%, where that is a standard deviation. But EQ partly genetic, but it can be developed. So it can be developed throughout the life. Predicts IQ predicts school performance, while EQ is important for the emotional health, physical and emotional wellness and success. So for success, EQ is more important than IQ. Then IQ we can be measured by standard test available, and now even for the EQ, the standard tests are available. So overall increase in IQ by 15 to 20 points in children in last 3 decades, but deterioration in IQ of children over the world in last two to 3 decades. So actually, uh, emotional will is very important, where you can see your all emotions are traveling uh, from outside to the inside. So suppose we should know there are 10 basic emotions like happy, trust, fear, surprise, sad, disgust, anger and anticipation. And uh, we should know that they are traveling like the child may be having some joyfulness and then turn into happy. So that type of things can happen. Or when child has fear, child may be cautious or anxious. So that type of things you can come to know. So EQ and academic performance, there are four pillars of emotional intelligence. One is self-awareness, self-regulation, social skills, and empathy. So self-awareness means recognize your own emotion or understand how they influence your action. Self-regulation is managing emotions in a healthy way. So adapt to changing circumstances. And empathy is understanding other people's emotions, and social skill is building and maintaining relationship effective and communication. So then actually here it is very important that academic achievement is also dependent on this emotional intelligence, with having conceptual framework like empathy, self-awareness, self-regulation, social skill and motivation. So actually understanding how emotional intelligence and shapes are actually understanding emotion and managing emotional reaction as well as empathy and long impact are there. Uh, Role of EQ in sport achievement, where actually pressure handling is very important in the sports, because EQ, if EQ is good, then definitely that captain handles pressure better. Like Mahi, we have seen was always cool on the ground. So, staying composed under high stake pressure and panel assessment, emotional stability, managing fear, anxiety, anger during competitive comments, confidence and presence. So, displaying the calm body language and mental strength. And that's why Mahendra Singh Dhoni was the best captain, having very good emotional intelligence. So team communication and adaptability. So adjusting quickly to unexpected instruction or performance feedback, which is again very important. Even Rohit did many times that very good adaptability. So that is again very important. So actually understanding emotional hijack is also very important concept, where when faced with the perceived threat or strong emotion, the amygdala, which is a part of brain, actually can trigger a rapid automatic response often labeled as fight, flight or freeze, and that we should know. So actually we will not go into amygdala hijack because that is not very in to know that in very detail. But most important is regarding this 6 second pause. So the core idea is that chemicals which are associated with intense emotion only last for about 6 seconds. So मुझे ऐसे लगता है कि ये मेरी जो फ्रेंड है उसने बहुत गलत किया मेरे साथ। ऐसे कॉलेज की एक दो लड़कियां ऐसे बात कर रही थी कि जो 12th स्टैंडर्ड में थी। तो वो 12th स्टैंडर्ड वाली लड़की बोली अरे ये इसने अलग क्लास लगाया, मुझे बताया भी नहीं, इसको मैं दो चांटे देनी चाहिए। लेकिन उसने बाद में सोचा कि चलो मैं 2 मिनट रुकती हूँ और फिर सोचती हूँ। फिर उसने 6 सेकंड सोचने के बाद में उसको लगा अरे वो गलत होगी, लेकिन इतनी तो पागल नहीं है कि उसको चाटा लगाया जाए। फिर बाद में थोड़ी देर के बाद में उसको ऐसे लगा कि अरे ये तो मुझे ऐसे लगता है कि उसने कुछ प्रेशर में आके किया होगा, या उसको टाइम नहीं मिला होगा मुझे बताने के लिए, ऐसे भी हो सकता है। So then she started thinking from her side also. So this happens because of the pause. So you should not take any decision when you are at the peak of your emotions. That is the important thing. Means our grandmother used to tell us that देखो, गुस्सा आने के बाद में क्या करो, एक कुछ भगवान के नाम ले लो, 10 नाम ले लो, 1 से 50 तक गिनो। सो दैट डेफिनेटली हेल्प्स। बट ये हमारे यहाँ पे जो बताते थे इसकी तरफ कोई ध्यान नहीं देता था। बट यूएस में जब उसको 6 सेकंड पॉज करके एक अ, संगठन निकला, तो उसकी तरफ सब ध्यान, उसका ट्रेनिंग लेने के लिए भी लोग यूएस जाने लगे। So that is very important, that actually this was there in our society also from very long time. So by intentionally pausing for 6 seconds, you can interrupt this cascade of emotional chemicals and create an opportunity for your prefrontal cortex to come online. So this is a rational part, prefrontal cortex, and actually this pause allows you to evaluate the situation, consider your option, and choose a more conscious and constructive response rather than reacting solely based on emotion. So how to use 6 second pause? So recognize the trigger. So be aware of the situation or trigger that tend to evoke strong emotion response. Take a deliberate pause, engage your rational brain and respond with intention, so which is based on your evaluation. Choose a response that aligns with your goals and values. And what are the benefits of 6 seconds pause? Because it improves your emotional regulation, so you can make better decision, stronger relationship, increased self-awareness, and reduce stress and anxiety. So 6 seconds pause is a simple yet powerful tool for developing emotional intelligence and responding to challenging situations with greater awareness and control. So different anger management skills we can see: identify trigger, warning signs, talk to somebody, try breathing or muscle relaxation, walk or exercise, step away from the situation, and reframe your thinking. So there are many techniques like relaxation technique, cognitive structuring, communication skill, problem solving skill, then timeout technique, exercise, healthy lifestyle habits. So there are many things, means actually where we usually say that whenever your child is angry and he's throwing the objects and all, you just be calm, and whatever the things you can give it immediately. If you do not want to give that immediately, then say no. And even you after saying no, you are also other members in the family also should say no. And whenever the child is throwing tantrum, just wait and watch, do not interfere that. And after 10-15 minutes child becomes normal, and then talk to child normally. Don't say that अरे आप इतने अच्छे बच्चे हो, या ऐसे क्यों किया, वैसे क्यों किया, ऐसे कुछ नहीं बोलना है. So this is called as timeout technique. Then exercise, healthy lifestyle habits, all these are very important. So anger management skill, uh, like relaxation technique and cognitive restructuring also we have seen. So what are the benefits of high EQ? So better decision making, improved interpersonal skill, effective conflict resolution, reduced burnout, and more consistent performance. So that is very important. So emotional literacy. Now, last 10 minutes for the emotional literacy is the ability to identify, understand, and express emotions in a healthy way, and is the capacity to recognize, label, and understand feelings in self and others. So actually, children with a strong foundation in emotional health, they can engage in less destructive behavior. They are healthier. They are less lonely. They are less impulsive. They are more focused. Have greater academic achievement. Tolerate frustration better and get into fewer fight. So, what are the 4 strategies to develop emotional health? Using the adult or child relationship to expand an individual child's awareness of his emotion or a feeling. Then finding opportunities in the group setting to talk about feelings using enriching language tool or modeling the positive relationship. So actually, strategies to develop emotional health are very important, and either verbally acknowledging or labeling emotions, or assisting children with the regulating their emotion, talking about the fact that feelings can change, and using questions about feelings to see if a child can respond. Then finding opportunities in the group setting to talk about the feelings are also important. Then finding opportunities to means, by clarifying the rule or helping the children learn to put into the words how they think, and using enriching language tools. So that is very important. So choosing books or music or finger play with a rich vocabulary of feeling words, and using puppetry or felt board stories that retell common social experiences and that emphasizes the feeling of vocabulary as well as conflict resolution. So that is very important. So modeling positive relationship between adults with caring setting and with other children. So what are the components? Identifying feelings, labeling feelings, expressing intensity of the feeling, identifying non-verbal cues and emotion knowledge. So identifying feelings, imagine you are a 10-year-old child and try to fill this in the blank. When I am waiting for my result, I feel dash dash dash. So what you can tell? Okay, yes, actually here it is very important that you must use the word. And what are the words? So label. So labeling or giving name to your feelings is very important. So let's play another. When I am pressed with scoring 99%, I feel good, but actually I am relieved. So uh, such type of these are the word vocabulary which can be used, and you can use that vocabulary as a positive or negative vocabulary. It can be used. So this is again emotional thermometer where I feel little hurt, I feel extremely hurt, or 2 out of 10. And this is selected families of emotions like fear, anger, surprise, disgust. So, and in that again there are sub emotions also are there. So non-verbal cues are important. Our lips may tremble when we are afraid. Our forehead wrinkles when we are concerned or confused, and when people tap their fingers or feet, they are usually feeling impatient. So emotional knowledge is very important. Recognizing what events are likely to trigger different emotion, realizes that the emotion can progress over the time, and provides rich emotional vocabulary. So here activities are very important. Direct teaching, indirect teaching, songs and games, and use children's actually guess the emotion. Such type of things to be actually put on the board. So direct teaching of vocabulary, examples of emotion card like I'm happy, I'm sad, or I'm frightened, or I'm angry. So such type of card can be used. And indirect teaching, actually here Tamika and Tanaya seem really happy to be playing together, and they keep hugging each other. That type of thing can be told. Then use of songs and games, like if you are sad and you know it, so try a tear. And if you are mad, so use your words I'm mad, and such type of there. Then how does your face look when you feel proud, and what makes you feel proud? So simple game also can be given to the child. uh, and then feeling wheel also is there. So stories of emotion like grief, guilt, or jealousy or hurt. So then there are actually these cartoons can be put on the board. So recognizing the anger can interfere with the problem solving. That is again I have already told about that. how to recognize anger, and learning how to calm down and understand the appropriate ways to express the anger. So teach the children how to calm down. Take three deep breaths, blow out the candle. So such type of things you can tell about emotional regulation. So code words like chill out, cool down, code red, or hot engine. So such type of words can be used. Then turtle technique, actually this is a technique again about the actually controlling our emotions also, and that is again very good technique. So how to increase your own emotional awareness: emotional log, journal writing, painting, drawing, music, sit in silence, time spent alone, practice relaxation technique. So actually becoming an emotional coach is very important. So be aware of your child's emotion. Recognize emotional expression as an opportunity for intimacy and teaching. Listen empathetically and validate feelings. Help the child verbally labeling emotions. Setting limits while helping the child can give problem solve. So strategies are: always go stepwise. Do not miss any step. Never criticize or humiliate. Be patient, positive, and never impose your solutions. Give them choices. So use specific praise. Actually, give children just enough information to get started. Talking into a slow and calm manner. Wait for the child to do something right and offer specific praise for that action. Add just a little bit more instructions and repeat. So when to postpone emotional coaching? Press for the time, presence of audience, too tired, need to address serious misbehavior, and child is faking an emotion to manipulate. So method to enhance EQ, like recognizing own emotion, self-awareness, self-management, empathy, that is make comfort to connect, conflict resolution, effective communication. So practice mindfulness, practice meditation and relaxation technique. So that is again important. So to summarize, IQ remains same after 6 years with the standard deviation of 15%, but EQ can increase in any time in life. Emotional vaccine is prevention for the problems in the adolescent. Emotional coaching should be started as early as possible. Labeling emotions and knowing emotional wheel can prevent emotional outbursts, and emotional literacy helps to achieve better in the life. So thank you very much. Thanks a lot.
Yeah, thank you so much, Doctor, for sharing those valuable thoughts. That was a
Yes.
wonderful session full of clarity and perspective. Let's now take a few questions and dive a little deeper into this important discussion, sir. So, with all your permission, can I take question?
Yes, yes, you can.
Okay, sir. So the first question we received, sir, to start with, could you please explain what emotional literacy means in the context of adolescent development and why it's becoming such a critical focus area in pediatrics today, sir?
Yeah. This is very important question because nowadays the adolescents, actually we are seeing the Gen Z or whatever the exploration of their emotions, and the extremes of their emotions we are seeing day in and day out. So we, as a parents as well as a, actually nowadays give knowledge about their emotion and how to control their emotion. So emotional literacy means actually they should identify their emotion. That's okay. Okay, every emotion is normal. Means even anger is not bad emotion, but how to do with that? I have told that as an example that when I was traveling to my office, I got a roadblock, so I was very annoyed, and for say I was getting late for half an hour, so I may have actually problem for my from my boss. But next day, what will I will do? So with that anger, what I am going to do is that either I am going to start half an hour before, or I am going to take another road. So
Yeah.
that angry emotion has helped me to change my problem, to handle my problem. So that is very important. So what you are doing with that emotion next is very important. That's why you have to label your emotion. And so in many schools nowadays there is a board, and there are stickers, and in front of that child's name he has to take that sticker and put it on. So teacher will come to know that whether the child is in happy mood or child is in bad mood. So according to that they can handle that child. So that is nowadays many schools have started. So that is a very important thing that they should first important is that labeling. Second is that emotional vocabulary, which is very important. So what has happened to you must understand, and then you have to find the solution. So then after that, what are the solutions? What are the options that we can come to know?
Okay. Thank you
That's
so much for this. Yeah. Thank you so much for this brief answer, sir. So we are moving ahead with the next question, sir. Okay, so the question we receive, we often see that teens struggle to talk about what they feel. What are some early signs of emotional distress parents or teacher should look out for, and how can they respond appropriately, sir?
Yeah. This is again very nice question. Actually, very means we can say that as a red flag signs for the emotional disturbance. So maybe that child will not talk to his colleague, or may not be interested in the things which he previously was. Means previously he used to play and take part in the various activities, but nowadays he is telling that, oh, I'm not interested, I will not take that part. And sometimes that happen that his appetite is decreased, or appetite is increased more than normal. So he may feel that whenever I'm eating more I get satisfaction. So that type of thing can happen. So either appetite is increase decrease, either their interest has been lost, or they have some feelings like I'm not interested in this world. So like that means whenever they have a suicidal ideation, so they talk like this. So you have to be very careful for these children, and we must actually talk to them and get their feelings inside. And the most important is that cognitive behavioral therapy, like therapies, they what they do is that they change their ideation or their feelings, and then they can ask them to think rationally. So that is very important. So actually whatever the thing means, I told that 6-second pause, which is a very nice technique to actually control your emotions. So such type of things are there. And then adolescents, there are many other features also, that they can do self conflict also. Means they can do the self injury, which is again actually alarming sign for the suicide. So that type of things we should be very keen to observe on that. And there may be some drug abuse, or there are few things like there is decrease in the scholastic performance, or child may have excessive sleep, or very less sleep. Both are problematic. They may be more on the laptop or mobile. And addiction, mobile addiction is nowadays the dreadful addiction. Actually it is more than the alcohol. And this definitely have impact on the children in many forms. Like they are guided badly by the mobile in the form of pornography or other things. So that's why it is very important that what your child is doing, you must be very keen to observe on your child's behavior. And if it is deviated, then what deviation has occurred, you should observe and definitely take a help of adolescent consultant.
Okay, that's very insightful, sir. Thank you for the answer. So now we are coming to the next part, moving ahead with the next question, sir. So the
Yeah.
third question we received: how can schools and parents work together to build emotional literacy in teenagers? Like, are there practical approaches or daily habits that can help improve emotional awareness and resilience?
Yeah, this is very important that the parents and school should work together. This is very important point, because many times what happened that children may behave differently in school and differently in the house, and that's why parents many times may not know what the child is doing in the school, or even child is bunking the school, or may not actually sometimes parents go to the school and they found that since last 15 days child has not come to the school only. So that type of things do happen, and that's why it is very important that they should work together. So we, as a IAP, Indian Academy of Pediatrics, we are working on this as a module, and that module also has been trained, means actually with Dr. Sandeep Kelkar we have done that module in many places in 2015-16. And I think it is very important that we should make aware pediatrician, teacher and parents about emotional problems as well as emotional literacy. So they should teach them how to become emotionally literate. And emotionally literate means actually not only to identify that emotions but to control them also. So all things can be trained them with the workshop, with the pediatrician's help, and school can arrange that workshops in the school. Actually, we are now going with the very interesting module by IP, Sampurna Swasthya, and that Sampurna Swasthya is also getting into the schools. In many schools, we are doing where there are wonderful videos are there, and we are concentrating on the mental health as well as nutrition of the children. So I think such type of module can be used by the uh, mm, this thing schools, and they are free of cost. So I don't think that they should be worried about that. So they should approach their pediatrician in the town, and then can manage the things.
Okay, thank you so much, sir. That's very insightful, and thank you for this brief answer, sir. So the next question we received, sir, as a developmental or behavioral pediatrician, how do you see the future of adolescent medicine evolving with emotional literacy at its core?
Yes, this is very important that adolescent medicine is now evolving a lot. So we, as a pediatrician, adolescent pediatrician, means I was the first batch student of Kerala University who started postgraduate diploma in adolescent pediatrics, and that started in 2006, and I was the first batch student. And so I know that what is the need, and Dr. MKC Nair has actually brilliantly covered all this module program, and it is a 1 year course which is run even today by Kerala University, and that is a postgraduate diploma in adolescent pediatrics, and that is required for, to be done by the pediatrician to know what are the medicine we can use. Suppose you have come across the case of anxiety disorder or depression. So in what actually we have to diagnose that. So we should know how to diagnose them with the help of some actually questionnaire or some test. So that training also we get in that. And then after that, suppose there is a mild depression, then you can do only counseling. But it is a moderate depression or severe depression, you have to start medicine. And you should know when the psychiatrist should be involved. So that is again very important point, because many times what happened that psychiatrist should be involved in few cases, because if it is a suicidal ideation or something like a serious problem, then you should involve them also. So it is a teamwork of a counselor, of a pediatrician, as well as psychiatrist if it is required. It is very important in all this scenario is that adolescent medicine, we have to not only mental but physical also problems like obesity. We are getting lot of problems of obesity, and even these children usually get earlier hypertension, may get earlier cardiac diseases. So that is very important, and that's why actually as I am a national secretary for NCDPA. So what is that is actually what we are doing is that national means chapter of the communicable non-communicable disease prevention academy. So non-communicable disease prevention academy means actually not what are the non-communicable diseases like diabetes, hypertension, cancer. So such type of diseases, they are how we can prevent them is very important, rather than whenever they are happening in the adulthood or semi-adulthood. We are getting this lot of children as well as adults. The incidence in children for the diabetes and hypertension is also increasing. So that's why we should know that how to handle them, what is the nutrition we can advise, or what are the lifestyle changes we can advise. These are very important.
Okay, thank you so much, sir, for sharing your deep insights and expertise on this vital subject. You have beautifully highlighted how emotional literacy forms the foundation of not just mental health, but overall development and lifelong well-being, sir. Sir,
Yes.
so as I cannot see any questions from audience, sir, so with
Okay.
all your permission, sir, I'm going to conclude the session, sir. And to all our viewers, thank you for joining us this afternoon on Med Talks by IGCP. Let's continue to support our teens, not just in their academics or health, but also in understanding and expressing their emotions with confidence and compassion. Until next time, this is Ada signing off. Take care, stay mindful, and have a wonderful afternoon, sir. Thank you. Thank you,
Thank you.
sir.
Thank you very much.